Hello and welcome to this special edition of Campus Debate. We are with the students of the University College of Medical Sciences in New Delhi. These students are interns, they're postgrads and they're undergrads, and they're studying to be doctors, a very noble profession like we all know. But what I want to talk about with these students is, first of all, why they really want to be doctors. What is it that attracts them to the medical profession? Many thanks for joining us on Rajya Sabha Television. First up, by a show of hands, do all of you want to be doctors because you always wanted to be doctors, or because other factors played a part? Who wanted to be a doctor since he was a kid, he or she was a kid? That's about 50% of you, I think, 40 to 50% of you. That's a pretty good, decent average. Now, let me come to you now first. Why did you want to be a doctor? What attracted you to the medical profession?
I was good at biology and I had a knack for it. I always did well in the subject. So my parents encouraged me. I knew I had to take up science. So there was a choice between non-medical and medical. So I was good at it. So I thought might as well take it up as well.
And have you regretted the decision ever?
No.
You haven't?
No,
right.
I haven't.
That's what you expected to say. But moving on and looking at the medical profession in India, it has evolved over a period of time. We all understand the medical profession, doctors to be noble people who try and help people. The father of medicine, Hippocrates, I think was his name, if I'm not wrong. Yeah. Now he joined the profession for completely different purposes. What was your reason for wanting to become a doctor? What's your name?
I am Gaurav Singhal. I always found it very fascinating as to how the doctor gets to know what has happened to someone and how he writes the medicine, and we all get relief from our pain. And the second reason I wanted to be a doctor, because I used to hate mathematics, so I wanted to just ride off with non-medical.
Right. Who else hated mathematics? I think that's also a 50% percentage. I want to talk to you. What's your name, first of all, and tell me why it is that you want to be a doctor, apart from what the reasons that your friends have already told us. Was there any other special reason? Is there something about the profession that you really think sets it apart from other professions?
My name is Varun Kohli, and yeah, apart from the reasons that they have mentioned, our parents are forcing us and all, there is also another aspect of being a medical doctor, that you also get to do research work. And I was very much fascinated to do research from the beginning. In class 10th, I used to go for taking projects to different areas, and I got prizes for all that. So that's why I got inspired. Okay, even in medical sciences, in India especially, it needs research enhancement, because in India the research work is very limited, and if we go to US and all the places, the research actually helps a lot. There's this evidence-based medicine which is coming up in India also now, so the evidence comes from the research. So I'm very much fascinated.
Do you think there are opportunities for professionals who want to go into research, and do you think there is enough funding and infrastructure to help people who want to research?
Not really. That is the reason basically why my mother made me go for medical sciences instead of becoming a scientist. I wanted to become a scientist, and my mom said in India scientists, they don't get paid well, they don't get fundings easily, so there are many constraints. So doing research only is difficult in India because they're not promoted easily, and you don't get a chance really to go further. And even the baseline in India is very much less than other countries.
How many of you think that research and development in the medical profession in India needs to go a very long way to catch up with countries like the US? How many of you think? All of you. That's an overwhelming majority which thinks, I think about 100% of these students think that R&D in India needs further work, it needs more infrastructure, it needs more money, and the resources right now are not available. Coming to this side of the group right now, what's your name?
Virat.
Virat, why do you want to be a doctor?
Well, my parents are doctors, and right from the very beginning, I've been watching them treat patients and consult, right? And the respect and admiration they get after treating them, after letting them know that they're okay, that blew me off.
That's what attracted you to the profession. But do you think, I have a question for you, and it's a question for all of you actually. He was attracted by the admiration and respect that doctors used to get back in the day. Do you think, first of all, the doctors enjoy the same sort of respect? I'm not talking about all doctors, but most of them. Do you think all of them enjoy the same respect in this day and age? And if yes, why? If no, why?
Well, I don't really think so, because these days the doctors, they don't really sort of, they don't, they're not well mannered with the patients, especially in government hospitals. Most of them are not well mannered with the patients. So that's like degraded the status, the name of the doctor, which was previously, they were treated like gods. And now because they're not well mannered, not treating the patients with respect, the name has degraded.
But isn't it more complicated than just a bedside manner, I think? Do you not think that just a bedside manner can only account for that much? There are other problems in the medical profession. Who agrees? There are other problems. Now we'll talk about those problems in the medical profession in the country right now. What is the biggest problem facing the medical profession and the respect that Virat talked about, attached to that respect and that sort of dwindling of that respect? Who wants to talk about why respect for doctors and the medical profession has dwindled? Yes, your name?
My name is Prasoon. I just want to say that the main problem is that the doctors are not treating the patients. They're treating the symptoms, actually. They're treating, they are more focused about the diagnosis, not the status of living of the patient. So as a whole, if we treat the patient will be nice, but not the...
But do you think that's the biggest problem facing the medical profession?
It's one of the biggest problems.
It's one of the biggest problems. So fair point, I agree. Yes, you have a point.
As you mentioned that the doctors are not treating the patients, but if we see in the government setting, how many patients are coming in the OPD every day and the pressure they have to treat as many people as they could. So if we go to a private hospital, of course, there will be better management, bedside care and all. But the real thing is, in government hospitals, the doctors are actually helping these people, even though they're not respecting them as much as they should. But if they are helping them, treating them properly, because they are not able to understand every detail of the medical thing. So the doctors have to sometimes force them to understand. So that is the reason maybe why we see that the doctors are not respecting much. There is this line, they are fighting amongst each other who will go inside first. So there are many aspects of that, and I don't think you have to really blame on the doctor that he's not respecting the patient or something like that.
So treating symptoms and not patients, he mentioned. He also mentioned there's a difference between private hospitals and government hospitals, the kind of care they really get. Who wants to talk about the difference in the medical care that patients get in a government setting and as opposed to a private hospital? Anyone? Yes. Yeah, you haven't spoken. You've spoken. I'll come back to you. What's your name and make your point.
Hi, I'm Aditi, final year student. Imagine a room, 40-degree, boiling 40-degree room. There is no fan working. There are like 10 or 20 patients with their attendants screaming over the doctor, and the doctor is hassled by all the screams, and he wants to treat them, but he is just he's very hassled about it because they're like everybody is screaming at him, so obviously he'll behave little rudely that you can come.
You're saying
later.
he'll snap?
Yeah, he'll snap. It's human. He'll snap, but he really wants to treat the patient. I've come from the OPD right now, and I've seen the doctors. They really want to treat the patients, but obviously since there are like so many of them, we cannot control, so we snap. But in the private settings, a doctor has to treat like 3 or 4 patients, and he's getting paid much higher than what he's getting paid right now. So obviously he'll be all nice and he'll be all gentleman, because obviously it's AC room and there are only 2 to 3 patients, and all are well mannered patients.
I think Aditi makes a very important point. I want to talk a bit more about that, but that'll be after the break. When we come back, we'll talk about what the difference is really between a private setting and a government setting, and why people tend to gravitate towards private healthcare. We'll be back in just a moment. Don't go anywhere. Welcome back to this special edition of Campus Debate. We are with the students of University College of Medical Sciences in New Delhi. How many of you, by a show of hands, you've told me this before, but how many of you have parents who have doctors? Show of hands, please. I think that's a decent majority. How many of them really work and practice in urban centers? Pretty much all of them. I want to put this question to you, and you can raise your hand, whoever wants to answer it. When you do become doctors, when you are certified medical professionals, how many of you would really want to get out of an urban setting and go work in, a really far off rural area or a village? Would anyone like to do that, first of all? Yes, you. What's your name and why would you want to do that? And be honest.
I'm Abhishek. I think that people who are, let's say, fresh out of medical school would want to, work in a rural setting for maybe a year or two. But ultimately, being honest, I would like to come back. Let's say after at most practicing 5 years out there, I think I would like to come back.
But do you think you would want to stay there for at least 5 years?
Yeah, I think I can manage that.
Do you think you'll survive that?
I would want to do it because it's an interesting environment out there. I've been to villages here and there in the past few months, and I think that there's a serious lack of infrastructure, a lack of medical care out there. At best, most of the villages in our country have, let's say, a chemist, and he's the doctor there. So they're actually missing out on a lot, and I think I can survive 5 years out there. It's not much.
Do you think, knowing the fact that you will not be getting lucrative job offers while you're in that village, and you will not be living, driving big cars as you would want to, or living in a big house, would you still be okay with it? And would you still give 5 years of your life after studying for 5 years and more to become, working really hard to become a doctor? Do you think you'll be okay with it? And be honest about it.
Okay, now that you say 5 years, you said 5 years, and I think I'll give 2.5 or 3 maybe. But
so 5
I
comes
think
down to
we've especially people who are, let's say, at our age can really think about going there. We're reckless, aren't we?
Right, right. So I mean, I hope you have that reckless spirit in you, and more of your friends do. Who else want to speak? Who wants to speak? Yes, you haven't spoken. What's your name?
Hello, my name is Smile. I want to say that for 5 years, and we study in the best medical colleges of India, and they all have good facilities. And then after that, everybody wants to do a post-graduation course, and every hospital, it offers many new technologies. So if you are working in a rural setup and you don't have any sort of these technologies like modern machines and all, you want to treat the patient, but ultimately you need the help of those things.
Right, and you have to refer them to, say, a
yes,
city hospital.
then ultimately you have to refer them to a tertiary care or a secondary care hospital. So if you are working in a primary setup, then even if you know everything, if you want to treat, you are like a warrior without a weapon.
Right. I would like to still, yes, you have a point. Pass the mic to him, please. Yes, what's your name?
I'm Pranav. Unlike most of the people here, I'm doing a postgraduate course, and I have been in the wilderness for a while. And I'd like to ask you, Athar.
Where do you go? Where do you go?
I'm doing community medicine, and I worked for a year in critical care, and then I was in general practice for a year.
Which is in Delhi itself?
No, I was in Kolkata.
In Kolkata. Okay, yeah, go ahead.
Before I go ahead with my point, Athar, I would like to ask you a question. It's just been one-sided.
Sure.
You've done programs with engineers and MBAs, Athar?
Yeah.
Have you asked them whether they want to go to the villages, Athar?
I have, actually.
And
none of them want to.
So why blame the doctors?
Nobody's blaming you. I'm just asking you what you want.
There's this element of feeling that doctors are a noble profession. You said it, right?
But they're not anymore?
The COPRA doesn't put us as a noble profession. It just says a profession. We are providers and you are consumers.
Right.
So if you want us to be providers, why tag us with providerism and consumerism and nobility as well?
You're talking about the Supreme Court judgment where doctors were put under CPA.
I don't have a problem with that. But the problem comes when a doctor wants to drive a BMW, it's unethical. You didn't ask...
No, who says it's unethical?
I'm not saying... you said it unethical.
I don't think anyone says driving a big car is unethical.
There's this impression that doctors are supposed to be noble people and warriors.
But they're not.
All that. They're not. And rural setting, I want to go to rural. I quit surgery. I quit a lot of lucrative fields, and I took up a subject that deals with health policy and essentially preventive medicine.
Right.
So... yet, I would be very wary of going back to villages where I'll be the only medically qualified person for miles around. And at 2 a.m., a person with obstructed labor will come in and her partners will threaten, Doc Saab, ye bachcha bachao, ya fir khud bacho.
Right, right. So do you also think that there is sort of a security issue when it comes to dealing with the people in a rural setting?
Not just rural setting. I mean, right here in Delhi, there's a security problem. I'm sure when these guys go to the emergency rooms and start working as interns, they will have some of the worst life-threatening experiences ever. Like 10 or 15 people will gang up.
And that all adds to the pressure on a doctor, right? And it all adds to mental pressure on a doctor. It affects your work ethic as well. It affects your diagnosing as well, if that's the right word. Very good point, extremely good point that you mentioned right now. And I think, yeah, I'll come back to you. And I think moving forward from that point, he mentioned that he was working in that setting for a while, and there were, of course, challenges he faced as well. But let me put another question to you, and all of you, and you can raise your hands who wants to answer. What do you think really can be done about, I'll come to you, about really improving the scenario in villages, in rural settings, so that more and more doctors really want to go there? Perhaps not 5 years, perhaps just 6 months or even a year before they come back to the city and chase their goal, whatever that is. What can be really done? I want to come to you first. What's your name?
Hello, I'm Raghav.
Right.
I think to drive more and more doctors into the villages, we need to adopt a target-based approach. And that target should not be based on the number of patients you see. It should be based on the number of patients you diagnose it correctly with a supervision body over it. The more the number of patients you diagnose correctly, the more number of increments you should get based on salary.
So it should be performance-based.
Exactly.
Yeah.
There should be an index, like there in US and other countries. There is an index, and every 3 years a test is conducted. Similarly, if this kind of tests are implemented in India, wherein you get a score based on the amount of performance, and similarly you should get new, like he said, there are shortages of novel medicines, novel techniques. You should get that from the government. You should get more funds based on your performance.
And you say no such system exists as of now?
As of now, there is nothing.
And have there been, to your knowledge, any suggestions by any committees to incorporate these suggestions ever? Yes. Could you pass the mic to him? Yeah. Till he comes to you. Yeah, absolutely. Go ahead.
I think getting real about the scenario in our country, see, doctors are a scarce resource. Even in cities, when most of them stay in cities, they are mostly busy. And let's say to expect them to go to a rural setting, send all the doctors to the rural setting, most of them, you can't stretch a scarce resource this much. So I think that especially in a rural environment where they've got nothing, let's start with the basics. Let's say we don't exactly need doctors over there. I believe that you can have some paramedical services providers in the villages first. Because there are very simple diagnoses. It's a very simple thing. They require basic things. For example, let's say there's someone who has acidity. A simple tablet of, let's say, a proton pump inhibitor, rabiprazole can, prevent, maybe go on to prevent carcinoma in that patient, cancer in that patient. Right. So someone needs to be there to give him that tablet. You don't exactly need a doctor to be there. So doctors I think should be there they should be there at the secondary and the tertiary levels. And at the primary level, you need to have a strong referral system, something that cannot be dealt with. These people cannot deal with, can refer it upwards.
Right.
And
I take your point. I take your point. We have some more points coming in. We'll have to take a small break again. We'll come back and we'll come to you as well. We'll take another small break. We'll talk about the National Rural Mission and how it has really worked. These are budding doctors. These are almost doctors, one postgrad as well. I want to get their opinions on what they really think of the mission and has it really succeeded, and some other questions I have for them. We'll take another small break. We'll come back on the other side. Stay tuned. Welcome back. After the break, we are still discussing the medical profession with the students of University College of Medical Sciences here in New Delhi. Before the break, Abhishek, my friend, had a point there. There is one sort of point correlating to that one, and that's going to be yours. Yeah, go for it. What's your name?
So myself, Ankur, intern. When I was working in the medicine posting department, I felt that the doctor to patient ratio is very decreased in our department. We have major chunk of relating with minor illness like cough, cold, and the patient we treat are majority of from the rural areas. Then I think if, as Abhishek said, if we increase the number of doctors in the primary setup, then the majority of patient will be treated there. They're well counseled, well satisfied, and those only who need a serious tertiary care will come to us.
And your point is basically that you do need doctors around.
Yes, we need doctors there, and I can suggest one thing, that we can increase the 6 months posting during the postgraduate level. We have three-year course of postgraduate, and in that period we have peripheral posting also. So we can increase we can shift actually that peripheral posting to the rural areas, and as a postgraduate, we can very well manage the basic illnesses there and can transfer refer patient.
I take your point. I want to talk a little bit more about the rural-urban divide. Everyone here has heard of the National Rural Health Mission, the NRHM, I think it is called. Now, it's been on since, I think, 2004, 2003, 2004, 5. And the financial outlay for that has increased substantially in the last 10 years, I think. Who here thinks, by a show of hands, that the National Rural Health Mission has been a success, or at least a partial success? Who agrees? Partial success. So you think it's a partial success. Why is it a partial success? What's your name?
Hello, myself Korika. Yeah, it's a partial success. If you see all the mortality and the morbidity indicators after the implementation of NRHM, all the indicators have decreased. So it's a success. And even now, some patients who came to our OPD now, they have sometimes they have been referred from these primary health centers only by an ASHA or an Anganwadi worker. And especially the immunization program, it is very well carried by those peripheral health workers.
Do you think that if it's a partial success, if you think it's a partial success, do you think it has the potential to become a complete success?
Yeah, of course, but it needs more stuff. More more paramedical workers need to be employed there.
You're saying it needs more manpower?
Yeah.
And what else? What else does it need? Yes, I'll come to you. Resources, manpower, accountability, very important point. Accountability, yes, you had a point.
NRHM is successful in preventing a disease, but it is still a long way to go in treating diseases. Asha and Anganwadi are doing their job by telling people what to do and what not to do by preventing diseases, but still there's a long way to go for
anything
doctors.
else that can be done apart from what you said? Yes.
Recently, MCI had proposed a 3-year course, which was I think a short circuit to MBBS, what I would quote it as. And it was strongly opposed by most of the doctors. But if you carefully see, it's a very nice thing. I mean, if you have a 3-year course wherein you can only be trained to treat specific diseases, and so you can finish your medical course fast, and they should be only allowed to be practiced. They should allowed only in villages.
But do you not think there's a danger of the people who complete that course trying to become full-fledged doctors and trying to treat diseases that they're not qualified to treat?
Government should be responsible for maintaining this discipline or maintaining this stratification, wherein only they should be allowed only in villages. They should not be allowed to enter tertiary care or.
Okay, point taken. You had a point. Yeah, pass the mic to him.
There is a reason why MBBS is 5.5 years course and not just a 4-year normal course like BE is. And instead of increasing that, if we plan to decrease it further down, there will be a decrease in the quality of the person who is becoming a doctor. And as you mentioned yourself, they can also migrate to urbans, and we will be the sufferers because we will feel we have been spending 5.5 years and they're coming just having a 3.5 degree course. So if you have to make it a 3.5 degree course, make it universal. Why the rural? What we are saying is that 3.5 years is enough for rural and 5.5 is for urban. Is that what we are trying to say?
Abhishek, yeah, you have a point. Give the mic to Abhishek.
I think that there should be differentiation between the two. That remains a paramedical service essentially. They're like, let's say, they're like the some paramilitary strike
paramedics
force,
like they have.
Yeah, they're like the Central Industrial Security Force. They're not the army.
That's a very interesting analogy. Yeah.
So let's say keep the doctors at the tertiary level, the secondary level, and these people can deal with the primary healthcare problems. And it should be very clear that there are paramedical services. So
right.
I think that would solve the purpose most.
First him, yeah.
Actually, I support the point given by him. Actually, there should be a stratification thing. The load on the government colleges or government hospitals is so high because a specialist, MD specialist is treating a person with normal cough and cold. There is no stratification. Like in abroad, for going to a specialist, you should have a referral from your family physician who is MBBS doctor.
Right.
So out here, what is happening is that, especially in Delhi, in cities like Delhi, the cough and cold is being treated by a specialist doctor who is specialized to treat higher illnesses.
Right, point taken. A girl behind you, very briefly, I have to ask this side a question.
How many patients are there who go to a doctor and tell, first I want to see your certificate, then I'll get treated?
No, not many. No one actually.
Yeah, especially when they are, they are acute conditions.
So that's your point. I understand what you're trying to say. I want to come to this side. I want to come back to you as well. I want to ask you this. Given the fact that we've been talking for about 25 minutes now, and I've heard most of your views and what you really think of the profession and where it's gone, do you think really that even now, when you become doctors, when you become certified medical professionals, do you really want I'm talking about super specialty hospitals, private healthcare, and would you, given a choice, would you really go and work for a government hospital and a government scheme rather than if you get an offer from, say, Mr. Moneybags, who has a big hospital and become a private hospital? Who wants to go and straight away work for a private facility? 1, 2, I think that's about 50% of you. Why is that? I mean, given the fact that he said he would go for 6 months or a year and work in a rural setting, why don't you want to do that? Why wouldn't you want to do that?
First of all, in private, what happens is you are not the only doctor. There is a whole team behind you. There's a pathologist, there's a microbiologist, there is a...
The support structure is
the support structure is very strong in private sector. So even if if you're stuck somewhere, there'll be a radiologist helping you, there'll be a pathologist helping you. Nothing like that exists in villages. So when you don't get the results, you're not encouraged to go there.
And you feel discouraged about your diagnosis, or
exactly. Then you start doubting yourself.
And that's very dangerous for a doctor.
Exactly.
Yes. You had a point.
What I wanted to say was that everybody wants to live a happy, contented life at the end of the day. We are putting in almost another 12 years after studying for 12 years, after coming out from +2 levels, to become specialists. None of the MBBS doctors want to stay MBBS doctors. MBBS today is a vestigial degree. Everybody wants an MD degree. There's nothing wrong with that. There's nothing unethical about it. The only way we would go to a village is that if doctors were not thrown as a symptomatic treatment, as a myopic vision for vote banks and anything, you develop the infrastructure first, give us the backing, give us the safety, security, give us the schools that we can send our children to. We'll go there. We want to serve at the end of the day.
Right. So you're saying you'd be okay with if all those problems and all those issues were taken care of, you'd not hesitate in going and going to a far off village and working if all those issues were taken care of. Absolutely. Does everyone agree with that? In one voice, does everyone agree with that?
Yes.
Absolutely. I think on that note, we'll have to end our show. I think it's been a very, very healthy debate since we're talking about medical profession. I think what we got from today's debate was that there are problems in infrastructure, there are problems in villages and the government health system there as well. There are some schemes that have really worked, but there are issues that doctors and budding doctors like these want addressed. That's the security, that's infrastructure, that's a support structure that they don't really get when they go to villages. If all that is taken care of, and that of course is the onus is on the government and government departments as well. If all that is taken care of, at least about 20 students who are going to be doctors very soon say that they will not hesitate to go into villages and serve the people they're meant to serve. That's all the time we have on Campus Debate this time around. We'll come back with another special edition next week. Till then, goodbye.